Today, the U.S. Food and Drug Administration approved a new indication for use for Wegovy, semaglutide, injection to reduce the risk of cardiovascular death, heart attack, and stroke in adults with cardiovascular disease and either obesity or overweight. Wegovy should be used in addition to a reduced calorie diet and increased physical activity. Cardiovascular disease is a group of diseases of the heart and blood vessels. Wegovy is now the first weight loss medication to also be approved to help prevent life-threatening cardiovascular events in adults with cardiovascular disease and either obesity or overweight, said John Sheritz, MD, Director of the Division of Diabetes, Lipid Disorders, and Obesity in the FDA Center for Drug Evaluation and Research. This patient population has a higher risk of cardiovascular death, heart attack, and stroke. Providing a treatment option that is proven to lower this cardiovascular risk is a major advance for public health. Obesity or overweight affect approximately 70% of American adults. Obesity and overweight are serious health issues that increase the risk for premature death and a variety of health problems, including heart attack and stroke. Wegovy contains semaglutide, a glucagon-like peptide 1, GLP-1, receptor agonist. Therefore, Wegovy should not be used in combination with other semaglutide-containing products or other GLP-1 receptor agonists. Wegovy's efficacy and safety for this new indication were studied in a multinational, multi-center, placebo-controlled double-blind trial that randomly assigned over 17,600 participants to receive either Wegovy or placebo. Participants in both groups also received standard of care medical treatment, e.g., management of blood pressure and cholesterol, and healthy lifestyle counseling, including diet and physical activity. Wegovy significantly reduced the risk of major adverse cardiovascular events, cardiovascular death, heart attack, and stroke, which occurred in 6.5% of participants who received Wegovy compared to 8% of participants who received placebo. The prescribing information for Wegovy contains a boxed warning to inform healthcare professionals and patients about the risk of thyroid C-cell tumors. Because of this risk, Wegovy should not be used in patients with a personal or family history of medullary thyroid carcinoma or in patients with a rare condition called multiple endocrine neoplasia syndrome type 2. Wegovy should not be used in patients with a history of a severe allergic reaction to semaglutide or to any of the other ingredients. Patients should stop Wegovy immediately and seek medical help if a severe allergic reaction is suspected. Wegovy also contains warnings for inflammation of the pancreas, pancreatitis, gallbladder problems including gallstones, low blood sugar, acute kidney injury, hypersensitivity reactions, diabetic retinopathy, damage to the eye's retina, increased heart rate, and suicidal behavior or thinking. Patients should discuss with their healthcare provider if they have symptoms of pancreatitis or gallstones. If Wegovy is used with insulin or with a medication that causes insulin secretion, patients should speak to their healthcare provider about the risk of low blood sugar. Healthcare professionals should monitor patients for kidney disease, diabetic retinopathy, and depression or suicidal behaviors or thoughts. The most common side effects of Wegovy include nausea, diarrhea, vomiting, constipation, abdominal, stomach, pain, headache, fatigue, dyspepsia, indigestion, dizziness, abdominal distension, eructation, belching, hypoglycemia, low blood sugar, in patients with diabetes, flatulence, gas buildup, and gastroesophageal reflux disease, heartburn. Wegovy received priority review designation for this indication. The FDA granted the approval to Novo Nordisk A.S. Wegovy is also approved to reduce excess weight and maintain weight reduction long-term in certain adults with obesity or overweight and certain children with obesity, for use in addition to a reduced calorie diet and increased physical activity. Related information. NIH. Overweight and obesity statistics. ####. The FDA, an agency within the U.S. Department of Health and Human Services, protects the public health by assuring the safety, effectiveness, and security of human and veterinary drugs, vaccines, and other biological products for human use, and medical devices. The agency also is responsible for the safety and security of our nation's food supply, cosmetics, dietary supplements, radiation-emitting electronic products, and for regulating tobacco products. Why weight loss medications matter in stroke prevention. Obesity is a significant risk factor for cardiovascular diseases, including stroke. Excess weight strains the heart and increases the likelihood of high blood pressure, cholesterol problems, and insulin resistance, all of which are key drivers of stroke risk. In patients with both cardiovascular disease and obesity, controlling weight and improving metabolic health are essential components of reducing this risk. Semaglutide-based drugs like Wegovy and Ozempic act by mimicking GLP-1, a hormone that regulates blood sugar, appetite, and insulin levels. By helping patients lose weight and control blood sugar, these medications also tackle the root causes of cardiovascular conditions. Clinical evidence and FDA approval. The FDA's approval of Wegovy for cardiovascular risk reduction is based on a large, multinational trial involving over 17,600 participants. In this trial, patients receiving Wegovy experienced a significant 1.5% reduction in major cardiovascular events, including stroke, heart attack, and cardiovascular death, compared to those on placebo. The trial showed that Wegovy, combined with standard medical treatment and lifestyle changes, was effective in lowering stroke risk. Dr. John Sheritz, director of the Division of Diabetes, Lipid Disorders, and Obesity at the FDA, noted that this approval provides a critical new tool in the fight against cardiovascular events, particularly in patients who face elevated risks due to obesity. A shift in stroke prevention strategy. This new guidance highlights an important shift in stroke prevention strategies. Traditional stroke prevention has focused on controlling high blood pressure, cholesterol, and other risk factors. However, the integration of weight loss drugs like Wegovy and Ozempic into cardiovascular care recognizes the pivotal role of obesity in stroke risk. This comprehensive approach addresses multiple aspects of metabolic health, which is critical for high-risk populations. Patients prescribed Wegovy should combine the medication with a reduced calorie diet and increased physical activity to maximize its effectiveness. It's important to note that Wegovy should not be used in combination with other GLP-1 receptor agonists, and patients must be monitored for potential side effects such as thyroid C-cell tumors, pancreatitis, and gallbladder issues. Conclusion. As the connection between obesity, cardiovascular health, and stroke risk becomes clearer, the approval of Wegovy for cardiovascular risk reduction represents a major breakthrough in medical treatment. With Wegovy and Ozempic now offering dual benefits, weight loss and cardiovascular event prevention, patients and healthcare providers have new, powerful tools to help combat one of the leading causes of death worldwide. Healthcare professionals and patients should continue to discuss the best personalized strategies for managing cardiovascular and stroke